Do you know what anxiety disorders are and how they affect us? Anxiety is a common human experience, characterized by tension, apprehension, and sometimes even terror. This sensation serves as an adaptive mechanism, alerting us to potential threats and activating our fight or flight response. It manifests in three key ways. Physiologically, anxiety involves the amygdala and neurotransmitters such as serotonin, cholecystokinin, epinephrine, norepinephrine, and dopamine. Psychologically, it distorts our perception, making us perceive situations as threatening, even when they may not be. Behaviorally, it prompts us to either escape or confront the perceived threat, which can disrupt our day-to-day functioning. However, it's important to note that anxiety becomes pathological or turns into a disorder when fear response is greatly disproportionate to the actual threat. It can also become a problem when the response continues even after the threat is gone or when it impairs social or occupational functioning. So, anxiety becomes a disorder when fear is greatly out of proportion, continues beyond the existence of threat, or impairs social or occupational functioning. Please subscribe now to join our community. Give us a thumbs up to encourage us to bring more interesting, challenging, and high-quality videos to everyone. How do we differentiate anxiety disorders from other conditions? A key question and one that requires a careful approach. When diagnosing anxiety disorders, a range of other conditions should be considered. These could be cardiovascular, such as post-heart attack symptoms, arrhythmia, or congestive heart failure. They could be respiratory, like asthma or chronic obstructive pulmonary disease. Even endocrine disorders such as hyperthyroidism or metabolic issues like vitamin B12 deficiency are potential culprits. Neurologic conditions and even substance-induced symptoms can mimic anxiety disorders. And let's not forget other psychiatric disorders like mood or personality disorders. Each of these conditions has its own set of symptoms, and some can mimic or even coexist with anxiety disorders. So, it's crucial to consider all possibilities during the diagnostic process. This ensures the most effective treatment plan is chosen, tailored to the individual's specific needs and circumstances. Remember, proper diagnosis is crucial for effective treatment, and anxiety disorders can often mimic or coexist with other conditions. What does the medical workup of an anxiety disorder entail? When a patient presents with anxiety symptoms, clinicians must conduct a meticulous medical examination to rule out other potential causes. This includes a detailed physical examination to check for signs of any underlying physical health issues that may be contributing to the anxiety symptoms. Blood tests, such as a complete blood count and thyroid function test, are also routinely performed to screen for any abnormalities that might be impacting mental health. Electrolyte levels are checked as imbalances can sometimes mimic anxiety symptoms. A urinalysis and urine drug screening can also reveal substances that might be contributing to the anxiety. In some cases, additional screenings may be necessary. These could include a neurological consultation to rule out any brain disorders, a chest X-ray to check for lung conditions, an electrocardiogram to screen for heart issues, or even a CT scan for a more detailed look at the body's organs. A thorough medical workup helps ensure an accurate diagnosis and the most effective treatment plan. Let's recap what we've learned about anxiety disorders. Anxiety is a universal human experience that ties into our survival instincts. It involves tension, apprehension, or even terror, activating our fight or flight response. The main brain structure involved is the amygdala, and neurotransmitters such as 5-HT, cholecystokinin, epinephrine, norepinephrine, and DA play a role. Our perception of a situation can distort and cause us to believe it's threatening, leading to a disruption in our daily functioning. Anxiety becomes pathological when fear is greatly out of proportion to the risk or severity of the threat, when this response continues beyond the existence of the threat, or when it impairs social or occupational functioning. Differential diagnosis can include a range of cardiovascular, respiratory, endocrine, metabolic, neurologic, substance-induced, and other psychiatric conditions. Medical workup may involve routine and additional screenings. Understanding anxiety disorders is the first step towards managing them effectively. Remember, if you or someone you know is struggling with anxiety, professional help is available.